Thank you for joining us for this session on operationalizing the One Health approach, where we dig into the successes and the challenges of this approach. Today, I'm joined by three speakers. Marion Koopmans, Head of the Department of Virus Science at Erasmus MC, Dr. Yewande Alimi, Antimicrobial Resistance Program Coordinator at Africa CDC, as well as Eloise, Todd, co-founder of the Pandemic Action Network. Thank you guys so much for joining me today. So Marion, thank you. Marion, I will begin with you. Just for people who may not be aware, can you just take us through an overview of what the One Health approach is and what it actually aims to do?
Yes, the One Health approach is a term that we use to describe the notion that the health of humans and animals and our environment are tightly connected and therefore also need to be looked at and understood jointly. So it tells us that instead of focusing, for instance, only on human health, it's really important to have a wider scope when thinking about health in general. So this applies to many of the public health aspects of human health as well. Think about surveillance, think about preparedness and response. It's really about widening the scope to be more holistic about this.
Thanks. That's a really great sort of overview of it. And I imagine that with the COVID-19 pandemic and now a possible monkeypox outbreaks, this approach is becoming more popular. Do you see people seeing its importance? I'll pass this question on to you Yewande.
Thanks very much. I think, yes, indeed, COVID-19 pandemic has really brought a spotlight to One Health. For decades, we have, as technical experts, have continued to advocate for a holistic approach across sectors. But COVID-19 was particularly unique in bringing the spotlight because we have been able to move from the technical bit into something more relatable to policymakers, funders, as well as the general public. I think because of the impact of COVID-19 on the economies as well as human lives, more and more people started to get a bit more interested in understanding how diseases would naturally jump from animals to humans and how relevant the environment and ecosystem really plays into disease transmission and disease dynamics. So I think COVID-19 and many more outbreaks of zoonotic disease origin is really bringing the spotlight and relevance to One Health, using a One Health approach in addressing diseases. Over to you.
So Eloise, one thing that Yewande did mention is that it's becoming more relatable to policymakers. Are you seeing the same thing?
That's an interesting question. I think there have been spikes of recognition of the One Health agenda at the very outset of COVID and the origin story. That obviously went viral across the world and people are very aware of it. But where I think there's still a lot of work to do is to actually tell the story about what the interconnections mean between human, animal and planetary health. And really, while there's a great bed of understanding of that in the health community, as ever, we need to translate that to people in general, but also policymakers in the finance ministries, in the leadership positions, so that there's this broader understanding of what decisions they need to take. I would also say that in the advocacy community, the last 2 years, we've been really focused on the COVID response, particularly how to get more equitable access to pandemic countermeasures and the delivery on the ground. So it's been very focused on the nuts and bolts of the delivery of the systemic delivery. And so we need to take a step back as we enter this different phase of COVID and the onset of monkeypox, as you mentioned, and think about, right, what can we do through a One Health lens? How can we work together across more sectors so that we have a whole of society approach to these issues?
Thanks. You mentioned finances in there, which is something that I really want us to dig into a little bit later on. But Marion, I noticed you wanted to add something. Please go ahead.
Yes. So I think if we look at COVID, we also see that One Health is considered, but it's really considered a little bit superficially. So there has been a lot of attention indeed in the questions about the origins of the pandemic virus, which, well, many of us think came from the animal world. But we've also, during the pandemic, seen that the virus has been transferred back from humans into wild animals. Think about the deer populations in the US and Canada, and think about farmed wild animals, the mink situation. So that shows that even a pandemic, which seems to be a mostly human-focused problem, you really have to keep an eye out for what else is going on. And that attention is really difficult to maintain. During a rolling out of a pandemic, it's understandable that the focus and the response really is on the human health problem. But in the meantime, we see escapes. And that's a stark warning, in my view, of why we need to have this One Health focus. And a challenge also before we move to financing is that if you look, for instance, at the monkeypox problem, we have seen that coming. Yet it's very difficult to get attention for these problems unless there are human diseases, and there are human diseases in certain part of the world. So our biggest challenge is to find that attention and to get this awareness really about the early stages of what is happening, what you can do there to actually prevent the downstream problems from happening, and that is money worth spending, where you may not even see it because it's prevented disease. And that is a difficult message to get across when there's so many other priorities to think about, to worry about, and to pay for.
I definitely want to go into the finances, but you mentioned something really interesting. When you speak of monkeypox, you say we saw this coming. So what role should this approach, the One Health approach, be playing when we're thinking about pandemic preparedness? And I'll pass this on to you Yewande first of all.
Thanks very much. I think, like my colleagues have really said, it's crucial, and indeed we did see this coming. But I think there's certain lessons that we definitely can leverage on from our experience with the pandemic. For one, certainly we need to start looking at developing and strengthening a more coordinated surveillance system. And I say this not just around human health alone, but how do we start to look at picking up signals from the wildlife sectors as well as livestock and even domestic animals? How do we strengthen surveillance systems, not just in the human health sector, but looking at animal health and in the environmental health sector? I think there are certain things that in terms of coordinated surveillance and aspects of coordinated surveillance that we really need to expand to in terms of improving how we prevent and control zoonotic diseases such as monkeypox, which we are all talking a bit about. I think there are certain aspects, at least on the continent, the African continent, that we are starting to sort of diversify into and focus on, because we have seen the benefits in terms of COVID-19. And we definitely think it's going to work in our system. Looking at things like wastewater surveillance, for example, looking at wildlife surveillance, doing a routine surveillance. As a matter of fact, one key area that I think it's a good idea for technical experts to start looking at is the wildlife trade surveillance. How wildlife is being moved from countries to countries across continents. Also looking around things like strengthening the laboratory systems and networks to ensure that we have early detection. We at the African continent have developed a continental-based pathogen genomic institute, where we are starting to expand our molecular diagnostics and next generation sequencing infrastructure, not just to human health alone, but looking at it from the agriculture and animal health sectors, just to improve how early we are able to pick up these health outbreaks or these health signals as seen across different sectors. I think one key thing that we all need to start looking at is how do we integrate data to monitor and analyze health effects of climate change, looking at how the environment really impacts how disease dynamics and disease transmission really occurs across all sectors. Lastly, I think a few things that I think One Health would really play is in terms of how do we coordinate our response efforts. One of the things that we are trying to champion on the continent is starting to look at joint disease investigation. For example, looking at it from looking at the current sort of outbreaks that we are seeing beyond monkeypox. We are seeing Rift Valley fever outbreaks as well as Lassa fever. So one of the things that we are really championing and advocating for, because we realize how important One Health approach is building a workforce, a national, district level, community level workforce of a multidisciplinary team that can conduct joint disease investigation as well as joint disease response. Over to you to continue. Thank you.
Thanks, Wanda. You've given us so much to think about. Surveillance system, the data, building a workforce. And Eloise, I know that this is something that you've been working like passionately about. So what should we be doing to prepare for the next pandemic, and how should this approach, what role should this approach play?
I think we need to, first of all, it's the thing we all say, but we need to learn the lessons from this pandemic. And I think that there needs to be, there's various ways in which we can do that. We need to do that in real time more and more, both using data, but also we need to look back at that beginning phase, that crucial beginning phase of the pandemic, and look at all the different incidents that happened, from the spillover itself to the other. Marion mentioned the mink farming incident. And I think there are lessons that we can learn in different places and in different sectors. So, for example, in Europe, there was action taken on the mink farms to kind of quash the threat potentially. But maybe we should be looking more systemically and more broadly at what rules and regulations are in place. Are the systems really now fit for purpose? What more could be done in our sort of broader farming systems? You know, we need to kind of not just wait for something to go wrong in order to review, but really have that deep dive and take all the expertise that people like our experts on this call have already been telling us for years and years, and make sure that we're actually taking action on them. So at the Pandemic Action Network, for example, we work with many groups, over 250 now, different organizations that want to end this pandemic and prevent the next one and prepare for the pandemics that do unfortunately spill over. And so we want to make sure we get that messaging, those policy asks absolutely right, so that we can put pressure on leaders and finance ministers to take the actions that they need to take, so it doesn't just stay in the health world. And we also, just crucially, before I hand the floor back to you, is really this connection that was already mentioned between health and climate. You talked about awareness and how aware are people, and I think we can do a much better job of communicating that the more we have climate change, the more pandemics are going to increase. And so there's a double incentive there to look at One Health, to take action on climate issues and biodiversity, and also all the health system strengthening and surveillance strengthening we need as well. These issues don't have to be in competition, they are complementary and need to be taken together, and that will increasingly be the case.
Thanks so much. And Marion, so one thing Eloise put out there was, are people learning the lessons? So are we learning lessons? And then what should we be doing as we look to prepare for the next pandemic?
I think we are learning lessons, but maybe not necessarily jointly and globally. The example with the mink farms was interesting. We've seen very different types of response in different parts of the world. On the one hand, total elimination of the whole farming sector. There's been countries where they let the virus burn through the farms, and there's countries that have resorted to vaccination. So actually, by clearly monitoring what happens in those situations, we can actually learn what would be a way that works maybe in different regions about this. There's another lesson. There's been a lot of debate about was the detection of the problem early enough? And what we learned from the mink farming is that by the time, before we actually had our first human cases in our part of the world, the mink already had been infected as well. So, and that wasn't detected until a couple of months later. So it is really difficult to pick up these things early on. And one of the key things that I think we can learn is how do we actually make this tangible? How do we make this actionable? It's one thing to say we must be prepared and we need integrated surveillance, but you cannot expect that to happen immediately everywhere. But we can put some thinking into what would be hotspots, potential hotspots for new problems that you would focus on. And that's the kind of global intelligence that is out there that we could bring together to help make, for instance, this surveillance system that Yewande is mentioning, make that actionable. Where do we actually prioritize that? And the priorities and the focus of the activities may differ in different parts of the world, and that's fine as long as they are connected in terms of exchange of knowledge and data.
So Marion talks about working jointly and working globally, and one day you referred to all these surveillance systems that we should be monitoring. But working hard, it's easy to say let's work together, but it's actually difficult to implement that. What are some of the challenges of actually like putting this into play, having all these sectors that are so used to working in silos almost work together? What's your experience been with that, Yewande?
Quite interesting. I think we can all agree that although we make One Health seem very simplistic, saying everyone just needs to kind of work together to achieve better outcomes, it is quite complex. Looking at it from sectors, or looking at it from a low middle income angle, some of the key challenges that we see in terms of when we're advocating for coordinated surveillance is the disparity in terms of data standards that we see across different sectors. We also see that there seems to be, of course, because of the human sort of health implications, we see that the human health sectors are really more funded than the animal health or the agricultural sectors. The wildlife and environmental sectors have not been funded for a while, means that they are many decades behind other sectors in terms of standards, setting up the surveillance systems. I would like to agree with Marion to say that indeed there's no one-size-fits-all approach to this, but I think a lot of it is quite contextual. Things like ensuring that to address some of these challenges, you look around developing and data standards which can cut across different sectors for that quote-unquote interoperability that we aim to achieve. We also look at things around a political commitment. For the longest time, I think things like the agriculture sector and the environmental sector have not gotten that political push, or say for the, let's look at it holistically, the multi-sectorial coordinating mechanism in many countries have not gotten the right buy-in in terms of political backing, having legislation, policies, and financing to really support this One Health platforms or One Health coordinating mechanisms in these countries. And this is quite relevant to addressing not just zoonotic diseases. I'm looking at issues of biosafety and biosecurity importance, looking at antimicrobial resistance, looking at food safety. So I think those are the key challenges that we are seeing, at least on the African continent. Over to you.
Thanks
If
so
I
much.
can
And
come in on
Eloise,
that. Yes,
yeah,
sorry.
I was actually going to refer to you because you mentioned that you work with 250 organizations. How difficult is it to work together?
So our network comprises 250 plus organizations, and we organize in different ways continentally, Asia, Africa, Europe in particular, and in the US. But we also crowd people in around particular issues to try and draw on people's expertise. And I think one of the things that we want to do is really try, now this, we're entering a different phase, there's still work to do. We're still very focused on making sure those that need pandemic countermeasures of the COVID response get them. But we also want to make sure that we are connecting the dots between different communities, so that at the Pandemic Action Network, we want to bring in an increasing number of people working on climate, biosecurity, food safety, the issues Dr. Yewande just mentioned, so that we're actually working together and saying, right, from a policy perspective, from a research perspective, from a what will work perspective, what should we be telling governments to do, and how can we unite our voices to be more powerful than different sectors alone? And I think the more we can do that, the more powerful we will be, and it's absolutely urgent that we do so.
Thanks so much. And Marion, you've been working on One Health for the longest time. What challenges are you seeing in the implementation?
I think one key challenge is the preparing for the unexpected. And how do you actually do that? So because my field has been emerging disease preparedness, where we have learned from, for instance, large avian influenza outbreaks, or now the mink situation, the monkeypox, earlier monkeypox outbreaks with prairie dogs in the US. So we learn from these, and then you can have post-event evaluations and recognize who you need around the table. But it is, I think the key challenge is how do you keep that kind of collaboration alive in peacetime? So I do think it requires constant ways of working together and thinking about maybe bringing some of the what now are siloed individual programs together. If you look at things like that from the laboratory's perspective, where I'm from, for instance, we don't necessarily need to have sequencing capacity separate for the human field and the veterinary field and the environmental field. There's no reason why that shouldn't be combined somehow. And there's examples like that in other areas. So my experience is that if you start to work with these multidisciplinary teams on common, maybe not so challenging problems, then you know how to find each other and what makes, what the language is of the different fields once there is an emergency. So it is really about, getting a sort of a routine practice in place. I think that's a key element.
I like the idea of keeping collaboration alive in times of peace. But I also imagine that collaboration itself takes resources. And one day you said that at the moment, human health has more funding than the other sectors, which makes sense on a surface level, but kind of shoots us in the foot later on. So are you seeing sort of these resources going towards collaboration, and what should we be doing to really ensure that we have enough resources to keep this alive when we don't have an emergency?
Um,
One
sorry,
day, go
that's the
ahead.
soon for
I'll
me.
come back to
Yeah.
you. Oh, yes, one day, go ahead. I'll come back to you, Marion.
Yeah.
Sure. Fantastic. So that is quite an interesting one, because one thing that you must agree with me, and my colleagues will agree, is with every sort of outbreak or pandemic that we have experienced, there seems to be, it's difficult to maintain that institutional memory. For example, if nothing is done, for example, we go back to the normal. Means we lose the funding that we have been advocating for other sectors. So I think in terms of additional resources, while we are seeing it in the context of the response, we haven't been able to translate it more towards the health system strengthening approach, such that most of the funding is mostly inclined to prevent or to control. But I think we need to put systems in place and fund health system pillars that can adequately be prepared for any health event. COVID has really has been very eye-opening in terms of the disparities around how sectors are being funded. But I think one unique approach, and I'm glad that Marion mentioned it, is how do we start to look around shared resources. For example, investing in a veterinary lab that can at least do the routine testing, which can adequately support human health. COVID has been a proof of concept on the African continent. At the peak of the pandemic, we had to pull in most of our veterinary labs to scale up COVID-19 testing. It has shown us this can work. So one of the things that we need to start doing is documenting the success stories. How can the best way to advocate for financing is when you're able to document a proof of concept. We need to start documenting the economic, the sort of the economic benefit, cost effectiveness of investing in certain key principles around One Health. For example, when you look at early detection, being able to pick up in the wildlife population, and how quickly it would prevent spilling over to human health, and the cost which it would reduce. Look at things like look at dialysis.
I'm just gonna jump in one day. Unfortunately, we're running out of time, so I'm just gonna jump in. Marion, you did want to add to this conversation on resources, please.
Yes, I think we should be careful not to spend the majority of the resources in coordination efforts. I think we really need money on the ground for real experiments, accepting that it will not be the solution to everything, but we need to get started. And those kinds of experiments, like One Health teams in different parts of the world, can then start to, demonstrate their value. Because we've been saying this for many years now, and I think we just need action.
And as we get to the end of our conversation, Eloise, I'm coming straight to you, Eloise. I want you to just share some closing remarks, your final thoughts as we go into this, and also just shed light on this resourcing issue. What should we be doing?
I just wanted to underline something Marion and Dr. Yewande alluded to, which is about the difficulty, and I think where we come in as civil society, we have to make the case and puncture the complacency or the neglect between the cycle of panic and neglect to make the case for the investments in a One Health approach, in prevention, in preparedness, is much more economically viable than waiting for the bad thing to happen. And we've seen a bit of a crisis of logic in this pandemic, and it's very, very hard to understand why, when governments have spent trillions on the response, it's hard to get the billions needed, albeit a lot of money, but not in comparison to the risk. So we've got to find better ways of communicating that. I think the One Health lens and agenda is a good way of doing it. And let's also be connected. So the action teams that Marion talks about are giving the results that help prove the case that can be spread to policymakers and get the funding needed. Thank you very much.
Thank you, Eloise. And just your final thoughts, your final call to action, Marion. We're running right at the end of our conversation. So in 1 minute, what's your final call to action? Marion.
let's just get going.
Let's get going, nice and quick. And Dr. Yewande, your final call to action on this?
Let's get going together across all sectors.
Wonderful. Let's get going together across all sectors. Thank you all for joining me. This was such an insightful conversation, and I wish we had more time to dig into the issues and the resourcing, but I know that our journalists will be following these issues and will be following your work. Thank you so much.
Thank you.
Thank you.